If you're over 55, the most dangerous misconception about stroke is that it always arrives without warning. Many strokes do strike suddenly, but the brain often sends short, reversible signals in the days before a major event. Those brief signals can look like tiny glitches in strength, vision, speech, balance, or understanding. They may last minutes and then disappear, tempting you to shrug them off. Don't. Those episodes are frequently transient ischemic attacks. The brain's alarm system, and the period of highest risk for a larger stroke is often within the next hours to days. If you learn to recognize these early signs and act the moment they appear, even if they fade, you can protect brain tissue, preserve independence, and in many cases, prevent the disabling event you fear. That is the purpose of this video. A physician's explanation, in plain language, of the early signs the brain may show up to about 10 days before a major stroke, why they happen, how to distinguish them from everyday annoyances, and exactly what to do the second they appear. The rule you will hear repeated is simple and life-saving. Sudden equals serious, and serious equals immediate evaluation. A stroke injures the brain because blood flow stops where neurons cannot survive without oxygen and glucose. In an ischemic stroke, a clot blocks an artery. In a hemorrhagic stroke, a weakened vessel ruptures. Either way, millions of neurons are lost each minute the tissue stays deprived. Modern therapy is time-dependent. Intravenous thrombolysis for appropriate ischemic strokes is generally considered up to about 4.5 hours from last known well, and certain patients with large vessel blockages can benefit from mechanical thrombectomy many hours later if imaging shows salvageable brain. Those treatment windows are the reason public awareness tools like FAST and its widely adopted expansion BE-FAST exist, so you can spot key symptoms fast and call emergency services without delay. Speed is not a slogan, it's the difference between walking out of the hospital and life with permanent disability. The brain's early warnings are rooted in the plumbing. Small clots can briefly lodge in a brain or retinal artery and then dissolve or move, causing a short-lived neurological deficit that looks and feels like a mini-stroke. That event is not harmless simply because it ends. It is a forecast. The best data we have show that the short-term risk of a major stroke is highest right after a transient ischemic attack, with a substantial fraction of subsequent strokes occurring in the first 48 hours. That is why even one reversible episode deserves urgent evaluation. Your clinicians can look for carotid narrowing, atrial fibrillation, heart valve problems, or other sources of emboli, then start the right therapies to prevent the bigger event. Treat the warning like a fire alarm. Respond now, not later. The first warning sign to memorize is a sudden change in strength or sensation on one side of the body. If your face, arm, or leg on the same side becomes weak, heavy, or numb out of the blue, assume a vascular cause until proven otherwise. People notice a coffee cup slipping for no reason, a foot that won't clear the floor, or a smile that suddenly looks uneven in the mirror. Because this can resolve quickly, it is easy to rationalize it as a pinched nerve or fatigue. Nerves compressed in the neck or back usually produce gradual, position-dependent symptoms. Stroke symptoms are abrupt and focal. If it's sudden and one-sided, act. These brief episodes are classic TIA territory and often precede a disabling stroke in the days that follow. The second warning sign is sudden trouble speaking or understanding language. If your speech becomes slurred, if the sounds are clear but the words come out scrambled, or if you can't follow a simple sentence someone else says, that is not getting older. That is a dominant hemisphere language network underperfusing. The temptation is to wait and shake it off. The correct response is to treat it as a neurological emergency and be seen immediately, because language disturbances, even when they resolve, are high-value clues that a clot just touched a critical brain region. The difference between catching this now and later is the difference between walking back out of the emergency department and living with permanent aphasia. The third warning sign is a sudden change in vision. This includes double vision, a gray curtain descending over part of your view, or vision vanishing in one eye for seconds to minutes and then returning. That last pattern, painless, transient loss of vision in a single eye, is called amaurosis fugax, and it points to reduced blood flow through the arteries serving the retina, most commonly from carotid artery disease on the same side of the neck. The retina is brain tissue you can see from the outside. When its blood supply flickers, consider it a direct preview of what could happen deeper in the brain. Do not wait for a second episode. A prompt vascular evaluation can prevent permanent vision loss or a cortical stroke. The fourth warning sign is sudden dizziness or a sudden loss of balance, especially when combined with other neurological symptoms. Dizziness can arise from innocent inner ear problems, but a cerebrovascular cause is far more likely when the dizziness is accompanied by double vision, slurred speech, one-sided weakness, numbness, or a new inability to walk a straight line. The back of the brain, the posterior circulation, controls balance, coordination, eye movements, and vital functions. Problems there can masquerade as just vertigo. If the onset is abrupt and you also notice gait instability, a crooked smile, a clumsy arm, or words that won't form, call emergency services. This is not the night to sleep it off. The fifth warning sign is a sudden, severe headache that is different in kind and intensity from your usual pattern, especially if it peaks in seconds or arrives with neck stiffness, vomiting, or confusion. Many headaches are benign, but a worst headache of life scenario raises concern for hemorrhage until proven otherwise. With hemorrhagic stroke, early diagnosis and blood pressure control, reversal of anticoagulation when appropriate, and specialized care can be life-saving. The evaluation is fast and non-invasive. Delaying it is dangerous. When in doubt with a thunderclap headache, you go, you don't wait. The sixth warning sign is sudden loss of part of your visual world even though both eyes seem open and fine. People bump shoulders into door frames on one side, leave food on half the plate, or read only half a sentence before giving up. The eyes aren't the problem. The issue is on the visual processing side of the brain, often in the occipital lobe or pathways that interpret the world to the left or right. This can be subtle, and family members sometimes notice it first. If your world is suddenly missing a side, treat it as a stroke pattern until imaging proves otherwise. Acting within treatment windows can preserve function you would otherwise never get back. The seventh warning sign is sudden confusion or difficulty performing a familiar sequence of steps. If dialing a phone number feels impossible, if a recipe you've made for decades suddenly looks foreign, or if you cannot follow the thread of a routine conversation, that is not garden variety forgetfulness. The cortex handles praxis, the ability to carry out multi-step tasks, and it struggles when clots reduce flow along its networks. Because this sign can look like fatigue, many people decide to rest and reevaluate later. That choice often backfires. A brief episode means a major one can be imminent. It's not overreacting to be evaluated, it's appropriate medical caution. The eighth warning sign is a sudden change in the way you walk. This may be a foot that catches for no reason, a knee that gives unexpectedly, or a veer to one side, despite your best effort to walk straight. Arthritis progresses over months and years. Vascular events announce themselves in a moment. If your gait changes suddenly, and especially if you also have numbness, weakness, or visual disturbance, assume the brain, not the joints, is asking for help. Every hour of delay in such a scenario is an hour the stroke team could have been reversing damage. The ninth warning sign is a powerful sense of tilting, falling, or not being able to coordinate your limbs, sometimes with nausea or vomiting, and often with double vision or slurred speech. This is a posterior circulation flag, and it is mistaken for a stomach bug far too often. If you feel like the ground is slanting under you and nothing else explains it, treat it as neurological until imaging proves otherwise. Remember that inner ear vertigo typically worsens with specific head positions and improves when still. Vascular imbalance often ignores position and partners with other nervous system signs. Sudden plus additional brain symptoms equals 911. The 10th warning sign is the category that justifies the titles 10 days before promise. Any brief, fully reversible episode that mirrors a stroke sign, one-sided weakness or numbness, speech trouble, transient monocular blindness, sudden imbalance that appears, lasts minutes, and clears. These are transient ischemic attacks. The mistake is to monitor at home because you feel normal now. The wise move is immediate assessment, even if you arrive symptom-free. The evidence is consistent. A meaningful proportion of serious strokes occur in the first 2 days after a TIA, and early evaluation cuts that risk dramatically by identifying the source and starting prevention right away. Treat transient as urgent, not as harmless. The response plan for any of these sudden neurological changes is straightforward. You check the time and call emergency services without delay. If you are in the United States, that's 911. In other countries, use your local emergency number. Do not drive yourself. Do not take aspirin on your own. Because if the event is hemorrhagic rather than ischemic, aspirin can worsen bleeding. Do not eat or drink until a clinician tells you to, because your swallowing function may be impaired, and aspiration is a real risk. If the symptom completely resolves on the way to care, you still complete the evaluation, because TIAs are warnings with the highest risk front-loaded into the next hours and days. The emergency team will ask for your last known well time. That number guides therapy. This is how you turn a crisis into a preventable event rather than a tragedy. Understanding why these symptoms cluster helps you trust your instincts. The brain is organized so that the left hemisphere controls the right face, arm, and leg, and vice versa. That's why one-sided symptoms are so telling. Language networks usually live in the dominant hemisphere. That's why speech disturbances are common when clots touch those arteries. The occipital lobes process vision, so field cuts, indicate cortical involvement rather than eye disease. The posterior circulation supplies balance and coordination structures. That's why sudden imbalance, double vision, or slurred speech point you away from the ear and toward the brainstem or cerebellum. A brief event that perfectly fits one of these patterns is a clot that arrived and left. The stakes are high because the next one may not leave. Knowing the map makes the decision to act much easier, and acting is what saves function. Because public-facing memory tools help in an emergency, it is worth mastering BE Fast as a mental rehearsal you can run in seconds. If balance suddenly collapses, if the eyes suddenly lose vision or diverge, if the face suddenly droops, if an arm suddenly won't lift, if speech suddenly slurs or becomes nonsensical, then the last letter, time, tells you what to do next. You call, you go, and you give the stroke team the opportunity to help you while therapies still work. Tools like BE Fast gain ground because they capture both the classic front brain signs and the often missed back brain signs, giving families a wider net to catch danger. There is no penalty for being wrong and going in. There is lifelong penalty for being right and staying home. It also helps to know where these early clots come from. Carotid artery plaque in the neck can shed tiny emboli that float upstream to the retina or brain, producing monocular vision loss, brief aphasia, or a transient arm weakness. Irregular heart rhythms like atrial fibrillation can generate clots in the heart that break loose and travel to cerebral arteries, causing sudden deficits. In either case, the workup after a TIA or stroke often includes brain and vessel imaging, heart rhythm monitoring, and targeted blood tests. Sometimes prevention is as simple as starting antiplatelet therapy. Sometimes it involves anticoagulation for atrial fibrillation. Sometimes it means a procedure to address a critically narrowed carotid artery. The earlier you enter that pathway, the more options exist and the more brain you save. While you cannot control every risk, you can improve the landscape the brain lives in so that tiny clots are less likely to form in the first place. Blood pressure control is the single most powerful lever. Unmanaged hypertension injures vessel walls and accelerates atherosclerosis. Cholesterol management matters for the same reason. Diabetes control reduces endothelial stress and the chance of unstable plaque. Smoking cessation reduces clotting risk and improves vessel health at every age. Movement most days of the week maintains vascular flexibility and supports a stable heart rhythm. Sensible sleep and treatment of sleep apnea, when present, protect the brain from nightly oxygen dips that fuel high blood pressure and arrhythmias. These aren't side notes. They are the environment in which your brain either thrives or struggles. Prevention does not negate the need to act on early signs, but it reduces the number of alarms your brain has to ring. Because recognition is easier when you know your own baseline, build a brief daily check into your routine when you feel well. Smile in the mirror and look for symmetry. Raise both arms and notice whether one drifts. Read a sentence out loud and listen for clarity. Scan the room from left to right to notice if any section looks missing or dim. Walk a few steps and pay attention to steadiness. The point of this ritual is not to search for disease every morning. It is to anchor your awareness of normal so that abnormal jumps out at you. If you live alone, this kind of self-check becomes especially useful because you are your own first responder. It's also helpful to prepare your logistics while you are calm. Store your emergency number in your phone's favorites. Keep a paper card in your wallet listing your medications, doses, allergies, and major diagnoses. Show a family member or neighbor where that card lives. Place a simple cue near your phone or on the refrigerator with the words, "BE fast, last known well, call now." When a stressful moment arrives, your brain will be grateful that you reduced the number of decisions it has to make. This is not catastrophizing, it is intelligent planning. Some viewers will worry that going to emergency care for a symptom that resolves will waste time or bother the staff. Understand that modern stroke systems are designed around this exact scenario. If your symptoms have ended, you can still be evaluated quickly, imaged appropriately, and started on treatments that close the window of risk with targeted precision. Teams want you to come. They would rather send you home safely than meet you days later with permanent deficits that were preventable. Your job is to notice and act. Their job is to sort, test, treat, and teach. Others will ask how to tell a TIA from a migraine aura, a seizure, or a blood sugar swing. Clinicians make those distinctions with a combination of history, exam, and tests, but there are a few general points that guide the go now decision. Stroke and TIA deficits are typically negative. Something stops working, whereas migraine auras often add sensations like sparkling lights or zigzags. Seizures may produce positive jerking movements or odd sensations followed by confusion. Low blood sugar often brings sweating, tremor, and hunger. Yet all of these generalizations have exceptions, and none justify staying home with sudden focal neurological signs. When you are older, have vascular risks, and notice abrupt one-sided weakness, language loss, visual loss, or balance failure, you do not self-diagnose. You go. To make the 10 days before claim precise and responsible, remember this: not every stroke is preceded by warnings, but a meaningful fraction are. Those warnings frequently come in the form of short-lived, focal neurological episodes that appear over the span of days or a week before a larger stroke. The brain is not being dramatic. It is being honest. It is telling you that a vessel is unstable or that clots are circulating. The safest way to honor that message is to seek urgent care every time. Nobody ever regrets the stroke they prevented. If you have stayed with me to this point, you already know more than most people about how the brain asks for help. You know that sudden, focal signs matter. You know that even brief episodes forecast near-term risk. You know that modern therapy is time-bound, that BE-FAST is the public's best tool, and that your action creates the opportunity for reversal and recovery. Put these pieces together into a simple personal plan. If a sudden neurological change appears, you note the time, you call emergency services, you do not drive yourself, you do not self-medicate, you go. If it clears, you still go. If it's not a stroke, you come home relieved and informed. If it is, you arrive in time for a team to do something about it. That's how you turn knowledge into protection, and that is why the brain's whispers over the next 10 days, and any day, are worth your full attention. You do not have to live in fear. You live with a plan. Share this information with someone you care about, because stroke recognition is a community skill. Teach the signs to your family, friends, and neighbors so that anyone near you can respond quickly if it's you who needs help. If this video clarified what to watch for, tell me which sign surprised you the most, and which part of the response plan you will set up today. If you want a printable one-page card with the exact words to keep by your phone, say the word, and I'll include it in the next video description. Above all, remember that the brain does not waste warnings. When it asks for help, it is giving you a chance to keep your language, your vision, your movement, and your independence. Take that chance today.